All right, let's go ahead and begin. Hello, everyone. Welcome to today's panel session brought to you by the Private Water Network. Thank you for joining us. My name is Reem Tariq, and I am a Senior Project Coordinator at the National Environmental Health Association. I'm also serving as the lead administrator for the Private Water Network. Today's session, which is part of the Private Water Network's 2 years since launch series, um, but sure, we'll talk more about the anniversary event in a second. Before we get into the details of the panel session, I would like to address a few things about the network. If you're not a member of the Private Water Network and are curious about learning what the network has to offer, then let me inform you that the network is a virtual community of public health professionals and safety workers that work with private drinking water systems. The network was launched by NEHA in partnership with the CDC and the National Networks of Public Health Institute. The mission of the Private Water Network is to build a sustainable community for those working to support the private water programs, to connect with their peers, to share experiences, insights, and resources, and to gain access to timely and relevant guidance for existing and emerging issues, to build capacity to do the work more effectively and efficiently in order to protect the public's health from contaminants and private water sources. Membership to the Private Water Network offers access to the virtual community platform that offers features of a virtual community, including a discussion forum, a resource library, an events calendar, and a member directory. Please note that this is a free resource to anyone who would like to join. The Private Water Network was launched nearly 2 years ago. Like I mentioned, through a partnership with CDC and NNPHI, and it was launched to build a sustainable community for public health workers and safety professionals working to support private water programs. So in the spirit of the celebration, the network is hosting a series of events this week and some updates starting January 31st. That's yesterday. We hosted a Twitter chat all the way through Thursday of this week, which is February 3rd, that will highlight opportunities and challenges that are associated with private drinking water sources. We thank you for the incredible work that you're doing with private drinking water sources and look forward to celebrating with you. Now, on to today's panel session. The title for today's discussion is Determining Locations of Housing Units Served by Private Domestic Wells in the US and Potential Impacts from Contaminant Sources. In this session, the speakers will discuss the methods for estimating locations of housing units served by private domestic wells and the proximity of private domestic wells to USTs in the US and their potential impacts. Today, we are joined by two speakers, Dr. Fran Kramer and Alex Hall. Dr. Fran Kramer serves as the senior scientist in the US EPA's Office of Research and Development's Center for Environmental Solutions and Emergency Response. Fran works with agency program offices, regions, and states and public/private partnerships to further research and its implementation in managing contamination, contaminant sources, and water quality. This has included foundational work in understanding the characterization and treatment of contaminant sources, to leading interagency efforts in conducting field studies to advance innovative technologies. She has led field projects ranging from treatment of contaminated shoreline in the Exxon Valdez oil spill to assessing impacts of flooding, debris management in the Hurricane Katrina response. Alex Hall serves as the geographer in the Office of Research and Development, Center for Environmental Solutions and Emergency Response. In this position, he is responsible for data analytics and the development of geographic information system tools in addressing source contaminants and impacts on water quality. His work has included the development of national database and web mapping application of underground storage tanks and private domestic wells, and tools to prevent contamination of source waters to protect public water supplies. Fran and Alex's current work continues to focus on managing contaminant sources and water quality impacts while addressing the implications of climate change and environmental justice. Some housekeeping rules before we begin our panel session. First, let's introduce ourselves. Say hello to the group by typing your name, organization, and location in the chat box. Also, the session is being recorded. The recording for the session will be uploaded onto the Private Water Network resource library after this webinar is concluded. We're hoping to have a very interactive panel session, so we highly encourage that if you have any questions, please drop those questions in the Q&A box or the chat box, whatever is most convenient for you. We will also share links to any resources that are mentioned in this presentation, and those links will be uploaded onto the Private Water Network as well. Just bear in mind that at the conclusion of the session, you will be directed to a short evaluation survey, as well as an annual evaluation survey, which I will talk about towards the end of the webinar. Please complete the brief survey as it does help us in planning and improving future offerings as well as the network. And with that, I will turn it over to Dr. Kramer and Alex.
Hi, good afternoon. Thank you so much, Reem, for the invitation to come to talk with folks here today and have this conversation about private domestic wells. It's a relatively small community of folks who are interested in private domestic wells, so we absolutely welcome the opportunity to talk with you today and certainly look towards developing a larger community amongst us and a conversation about any input or thoughts that you have with regard to private domestic wells and protecting them. So here today, we'll be going through an overview here in the next slide to give you some information really on the methods that we developed to update information on the density of private domestic wells at the census block level. So this will give you really the highest resolution data and the most up-to-date information on private domestic wells nationally. And as you'll see, and Alex will go through here momentarily, this is based on state drill logs as well as census data. And then likewise, he'll also just take you through a demo of the tool that you can readily use in your own time and pace. Also, what we want to cover today too, along with this, are the contaminant sources of concern. And one of the things that Alex and I work on is focused on underground storage tanks. And what led us particularly to undertaking this on the private domestic wells is just the sheer number of leaking underground storage tanks that we have and understanding where they are, where the leaks are impacting the private domestic wells. And there wasn't a readily available way to discern where these wells are located in context to our leaking underground storage tanks. So bottom line though, while we developed this for the underground storage tanks, the utility of this data is much broader than this contaminant of concern. Equally important now, of course, at even a very local level, are issues concerning contamination from septic systems. This is becoming a more dominant issue, not only for E. coli and nitrate, but other potential contaminants of concern impacting the private domestic wells. And so we'll speak a little bit about that. Likewise, we have areas in the country where we have higher density of confined animal feedlots and the potential impacts to private domestic wells. And some of our states have been working through this issue. Next, we have a number of hard rock mining sites where we have long-term impacts to groundwater from releases of the metals to the private domestic wells ultimately. And so we want to cover that briefly as well. Our Superfund and RCRA sites, we have information there too that we need to understand where these are co-located with the private domestic wells. And last but not least, we have large bulk storage facilities, both for oil and hazardous substances. And again, we'll give you a preview of what that looks like. And then lastly, an overarching lens that we have in the US EPA is looking at environmental justice and climate change and what this means relative to our sites and relative to public health impacts. And of course, this certainly comes into the arena here and looking at the private domestic wells.
Great, thanks, Fran. I'll jump in here. As the title of this talk suggests, Fran and I and a few other colleagues at the EPA set out a couple of years ago to really determine where our private domestic well universe is. And that is a difficult task, mainly because private domestic wells are not federally regulated, as many of you I'm sure know, in that well construction is permitted by states. So we didn't really have a good grasp of what our universe looked like. Really the last time we kind of understood where our well infrastructure was the 1990 census. In the 1990 census, in the long form, which is given to about 20% of the country, they asked, where do you get water supply from, public or private supply? And that was really the last time it was asked. In the ensuing 20, 30 years, there's been a lot of population growth and a lot of change in where people live. So, looking 20 years later, since 1990, we were kind of uncertain where our wells were. And this is important at the EPA if we've got, RCRA facilities, Superfund facilities, or sites, what's the potential for contamination? So we sought out to, estimate this. And we developed kind of a statistical model to do it. Kind of the axiom that kind of underpins the model, or the assumption, is that in 1990, if the ratio of well use, whatever the ratio was in the community, right, or a census block or a block group, it's fairly unchanged over time. So we developed a model to look at the change in housing units from 1990 to 2010, using the 2010 census, assumed that static ratio of well use, and estimated, updated our universe of where our private domestic wells are. And we can see that on the map there. These are the new estimates, 2010 estimates of housing units using private domestic wells by block group. Now, that was just an assumption we made about the domestic ratio of wells remaining constant over time. Well, we had to validate that. And to validate it, you'll see at the bottom, you'll see the RW method. This is the reported wells method. Basically, we went to 20 states that had really good driller log data since 1990. We used the 1990 census as a baseline, and basically through additive processes, kind of took the driller logs and estimated for these 20 states what the updated 2010 well use looked like. And we can see here, to validate our model, we can see on the left-hand side of this graph is our housing unit method, our statistical model. And on the bottom here, this is the empirical data, the reported wells by states. And you can see a very strong correlation between these, 0.95, 0.85, 0.82 R squared. I think globally it's like a 0.87 R squared. So our assumption was pretty much correct, that the ratio of people using wells remains constant over time, which is great. So now we've got a national model shown here of where wells are. And then we can also look at this by state, the number of wells by state. North Carolina with the most, around 1.5 million, and then Florida. And then here we can kind of compare the methods for the 20 states between the black and the gray bars here. And you can see that they're very close. So what did we find? So we published this data set. We published an article about it. What did we find? Well, in 2010, we found that there's 23 million housing units were relying on private domestic wells. That's about 52 million people, or 17% of the population. That was a large increase from 1990. In 1990, we estimated that only 15 million people were on private domestic wells, and so or 15% of the population. And here on the map here, we can see the change in the wells from 1990 to 2010. The reddish brown areas are areas where we lost wells over that 20-year period, and then in the you'll see the blue areas are areas where we gained wells. Right. So I'm going to show you kind of quickly what this data looks like. There's a publicly available map that anybody can go to. We'll link it in the chat here in a bit. And this contains estimates of private domestic wells for 220,000 census blocks or block groups and 11 million census blocks. That's all we can do here is just zoom into anywhere in the country, and we can get a sense of here private domestic well density, right? Wells per square kilometer. And this is at the block group geography or scale. We can zoom in even further and get a more refined resolution. We can look at it at the census block level. So again, there's 11 million census blocks. We have estimates for all of them. And what you're seeing on the screen here is it's interesting in two ways. We can see where there's a high density of private domestic wells, but kind of by subtraction, we can really estimate the public drinking water infrastructure in geography, right? As many of you may know, there's no national data set on public drinking water infrastructure. But this really kind of tells us two things, where the public infrastructure is and where the private infrastructure is. There's a couple of different ways we can kind of look at this data. Here we're looking at densities. We go in here and say, what's the percent of the population served by private domestic wells? Right, so black is 100% of the people in these census blocks are on private domestic wells, where white is 0%. We can look at it by just sheer counts. Here's just the counts of private domestic wells. Dark blue is the high, 75 wells or more, white 0. And if we want to look at this not just spatially, but also temporally, we can look at kind of the changes over time. So here's the change in housing units over the 20-year period. Red is areas where we lost wells, and then blue are areas that we gained wells. And again, we can really kind of see the marked difference between the East Coast and West Coast of the Midwest, where we saw quite a few wells being lost. So yeah, I encourage people to look at this. There's a lot of data in here. You can download it or just use this application. But this is the finest scale, most recent kind of data we have on our private domestic well infrastructure. And there we go. And then Fran, do you want to pick it up here?
Okay, thanks, Alex. So, of course, one of the things that we're looking at is how do we think about where our domestic wells are located relative to different sources of contamination. And CDC has provided setback recommendations that you can find on their site. And it, of course, includes septic systems as well as some of the agricultural applications and as well the underground storage tanks in addition to that. In contrast as well, the American Academy of Pediatrics provides very specific recommendations with concern to nitrate and the potential for methemoglobinemia or blue baby syndrome. So they have guidance that they provide on that. One of the things that Alex and I, a colleague, are working on at the moment too is to look at groundwater vulnerability relative to some of these source contaminants and where we would anticipate some of these plumes to go in time and space. So refining that information and understanding where our wells are relative to these sources is increasingly important, not only under the conditions that we have today, but also, as we'll talk through a little bit later, understanding climate change and those impacts.
And then, so Fred and I work very closely in the underground storage tank arena. Underground storage tanks are regulated by the EPA, and before we set out to do these estimates of private domestic wells, we didn't really know, how many wells could have been or are potentially contaminated by leaking underground storage tanks. Now, leaking underground storage tanks is a contaminant that you don't see. It's kind of out of sight, out of mind. They're underground. People don't think about them, but there's been over 500,000 releases from underground storage tanks. Currently, there's about 60,000 active leaking underground storage tanks in the country, and really wells are really the receptor of this contamination, typically BTEX, and of particular concern, benzene. So what we want to do is, look at our active leaking underground storage tanks, and basically what we did is we looked within 1,500 feet of all 60,000 leaking underground storage tanks. 1,500 feet is typically kind of the maximum extent given normal conditions of a leaking underground storage tank plume. So if there's a release, 1,500 feet is kind of considered the area of influence. And we wanted to look at how many wells could potentially be contaminated. And so here we're looking state by state in the map. Florida has 10,000 active leaking underground storage tanks, and there's 58,000 private domestic wells within 1,500 feet of those. Similarly, Michigan has 27,000. It's estimated that there's about 250,000 private domestic wells within 1,500 feet of an active underground storage tank release. And we mentioned before about our underground storage tank data set, and maybe I'll just, for a minute, I'll show you that and show you how you can apply this private domestic well data to potential contamination data, right? So here's a kind of aggregate map of leaking underground storage tanks by county. Red is 500 or more leaking underground storage tanks. We can zoom into anywhere in the country, and we can look at individually where all the leaking underground storage tanks are. Dark red here represents an active leaking underground storage tank, and pink is one that's been remediated. There's no further action needed. And what we wanted to do was kind of bring in the well data so we could kind of assess or triage risk to our private drinking water wells. So we have this filter tool where we can go in here and say, of all the leaking underground storage tanks on the map, show me the ones that have at least 40 private domestic wells within 1,500 feet. So I just did that there, and I just clicked that. And so we can really kind of get a pulse or a sense of if there's a release, one of these red dots, there's a lot of private domestic wells nearby. Maybe there should be increased sampling. Maybe you should be alerting homeowners, things like that. So this is just kind of one example of how to really incorporate well data, the specific source of contaminants. And I should say, we'll put the link in the chat too. But we've got a lot of data within this application, a lot of different tools. We have information just not on the releases, but the tanks as well and the facilities.
And so one of the reasons in particular that we're focused on leaking underground storage tanks are, of course, the fuel composition, and this relates directly to benzene, toluene, ethylbenzene, and xylene. Benzene in particular, if you look at the maximum contaminant level, this is the drinking water standard for benzene, is sitting at 5 micrograms per liter. And just roughly in gasoline, we're looking at some 6,000 milligrams per liter. What this then translates into is that we need some attenuation factor of about 1 million to think about the release of the fuel and the attenuation of benzene before it would hit a receptor of concern, in this case, a private domestic well. So that's not a lot of breathing room in terms of getting to that low level. And in particular, because the private domestic wells are unregulated, the concern generally is about, well, what is showing up in that well and how will it be detected? And in the case of benzene, the odor threshold is sitting about 60 parts per million, and the taste threshold varies between 0.6 to 4.5 parts per million. So if we're sitting down here with an MCL for the drinking water standing at 0.005 parts per million, we have orders of magnitude difference between what an individual would taste or smell, and they could potentially obviously be in a situation, a risk to them and their families in consuming the water from a well. So this really points to the need to have frequent testing in proximity to these facilities, and as well to be able to understand how that may change in time and space. And we'll go into that a little bit in a minute. Okay, so shifting here to septic systems. So this likewise is a concern specifically for E. coli and nitrate being of concern. And what we see many times is that the individual site conditions where a septic system is put in place doesn't always take into account the groundwater flow and where they're putting this in, and relative not only to the private domestic well that may be on site on that given lot, but also where is that septic system relative to the adjoining households and where their private domestic wells are, and is it upgraded or downgraded from that? So we see the potential here of, just the probability of pumping the septic system leachate into the private domestic well. There will be a lot of things that can alter that. Even if you have, say, a neighbor who has a private domestic well, and for whatever reason they have a high pump rate, maybe they're filling a pool, what have you, even those shifts in the pump rate can alter the local hydrology. So we need to think about where these septic systems are in the context of a given household, but also for the adjoining households and how they may be affected by these systems. And I think the other point, as you increasingly see, and what we'll go through on looking at a range of characteristics and contaminants of concern. A study was done up in Cape Cod within recent years, looking at a variety of contaminants and their impacts on the private domestic wells. And these included pharmaceuticals and flame retardants. But I think the biggest takeaway here that shows some hope is that indeed nitrate may be able to serve as a screening tool for these contaminants that may be impacting the private domestic well. So certainly we'll need to be following the advances in this arena, and are there screening methods that we could use short of some of these full-blown organic and inorganic chemical analysis that, one, are maybe cost prohibitive, or two, may not always be available, especially for the different types of PFAS that are under consideration today.
So I'll pick up on this septic tank conversation. Basically, I just kind of want to hit upon the idea of the co-location of private domestic wells and septic tanks. And basically, in brief, where there's private domestic wells, there's typically septic tanks. The map that you're looking at there shows any of the colored polygons there show the areas of co-locations between septic and wells, where there's areas where census block groups where 80% of the households are using both wells and septic tanks. So if you live in one of these areas, it's highly likely that you've got both of these systems probably in your backyard. We found that there's about 17 million people that where there's 80% of the housing units are on both septic and wells, right? And we can kind of look at the spatial distribution here. Where is this potentially an issue? We can definitely see it in Michigan and the Great Lakes states. and then definitely in the eastern seaboard and areas in California. This is just kind of another way of looking at it, but basically every dot on that graph represents one of the 220,000 census block groups. And we're looking at the percent of septic usage on the left and the percent well usage on the bottom, and just the relationship between the two. And what I just really want to kind of point out is this big black cluster at the bottom. This is saying if you don't have a private well, you probably don't have a septic system. But what we're kind of focused on is this, on the top right. And it's saying, there's a lot of people that are on both, 100% septic and 100% wells. And as Fran was describing, these are the areas that could potentially be affected by nitrites, and E. coli. So this is just kind of another way of looking at it. This kind of barbelled distribution of our septic and well locations. Maybe switching gears a bit, we can look at another contaminant source, confined area feeding operations, CAFOs. And just to kind of get a kind of a flavor of the issue, we looked at North Carolina. North Carolina, one of the biggest hog producing states, about 9 million heads of hog any given day. And then again, we took our well estimates. We want to see how many wells could potentially be impacted by these these operations. Found that there's about 26,000 wells within a half a mile of all the CAFOs in North Carolina. And you'll see the fourth bullet point here. The average percentage of wells using block groups with a CAFO is 65%. So in a neighborhood or an area where there's CAFOs, 65% of the residents are on wells compared to the state average of 35. And I should also point out that in Wisconsin and Kewaunee County, there's a study done where 50% of private wells near CAFOs were unsafe to drink, not meeting EPA water quality standards due to E. coli and nitrates, and that could potentially, you maybe interpolate that to North Carolina. And then importantly, just to put a pin in it, in 2001, the Wisconsin Supreme Court ruled that a current law gives the state authority to enforce water quality standards for private domestic wells through use of permit conditions for CAFOs. And so just to give you a sense of what this data looks like, every dot on that map represents a CAFO, and it's color coded to the number of heads. And we can kind of see some spatial autocorrelation, right? Where those dots are predominantly in areas that are blue. And the blue areas represent areas where there's a lot of wells. You can especially see in the southeast here. And this makes sense, intuitively. You don't have CAFOs in cities where there's public water. You have CAFOs in rural areas where there's high reliance on private domestic wells. And then Fran, I'll let you take it away.
Okay, thank you. So we're going to shift here to hard rock mining. And here the concern is just the sheer prevalence of these abandoned mines across the country. We have some 140,000 and potentially hundreds of thousands more of these undefined mines that we don't really have well documented. And some 22,000 they know, in particular, they've had an opportunity to evaluate some of the impacts of these mines. So safe to say, if you're near any abandoned hard rock mining operation, need to take particular care about private domestic wells. There were some earlier studies that were done on uranium and arsenic in the Navajo Nation, and it showed concentrations there exceeding the drinking water standards in well over 10% of those wells in the vicinity of the mines. The biggest takeaway here, though, to think about is where are these mines relative to the wells and understanding the transport. So if you can imagine for a mine, you're going to have a lot of preferential flow paths with the fractured environment, the tunnels, and certainly studies have shown that these contaminants can show up some 6 kilometers from actually where the mine is located. So how we think about private domestic wells in these contexts, I mean, our horizon and our vision about those impacts is certainly going to be much different, and how we communicate with the public about these sources and understanding the well impacts is absolutely critical.
And then switching gears, this map here, we're just showing the number of private domestic wells within, EPA's Superfund sites. We estimate that there's about 46,000 private domestic wells within a half a mile of a Superfund site. We just kind of aggregated that up by county so we can visualize it on the map. And that's serving approximately 100,000 people a day. 100,000 people a day are reliant on the unregulated water supply that's within a half a mile of some of the worst toxic sites in the country. So just another application to this data and to look at potential contamination of our water supplies. And then slightly adjacent to that, we can also look at landfills. There's different types of landfills. This map, we've got construction and demolition landfills. And these are typically unlined. They're not required to line them. And Fran, correct me if I'm wrong in that. But and then we've got just regular landfills and recyclers, and then landfills. And here's kind of the spatial distribution of that on the map. And with landfills, there's leaching into the soil, into the groundwater, and then again potentially into our wells. Of the 3,000 landfills and C&D landfills in the country, there's about 37,000 wells within a half a mile of these.
I think this particular slide on the landfills, just to maybe reiterate a little bit more, the construction and demolition landfills are found in many communities, and they are, as Alex indicated, they're unlined. So the leachate that could come from these can obviously impact the private domestic wells in vicinity of their. Alternatively, we have what's called subtitle D landfills. These are RCRA landfills that take most of our municipal solid waste, and those are lined and collect leachate. However, we have landfills that indeed there could be problems with regard to what's coming out of the landfill potentially. And then I think the other piece of the equation too is many of our landfills are coming up on what's called the 30-year time period, and we're looking at post-closure on some of these landfills. So it's important for states and communities to think about the future, where these landfills are located, and if they're in floodplains, and what that means relative to private domestic wells in these areas.
Switching gears a little bit, we want to kind of hone in on a specific state here. And here we're looking at Louisiana. And the EPA has a program called the SPCC, an FRP program. Basically, this regulates large, above ground oil and oil-like substance tanks. We're talking the 500,000, million pound, 10 million pound above ground storage tanks. There's that side of the universe that the EPA regulates. And there's also something called Clean Water Act hazardous substance storage facilities. These are facilities that store chemicals, but there's 296 of these types of chemicals. Many of them extremely toxic, carcinogenic, causes cancer. So I'm fumbling over my words. Have high acute aquatic toxicity and things like this. Bad stuff that's stored. And here, kind of want to focus on this Baton Rouge to New Orleans corridor. It's also known as colloquially as Cancer Alley. And that's where a lot of these above ground storage tanks are located. A lot of refineries, a lot of manufacturing. And here's just the blue and red colors are just the density of these of the quantity of substance stored. And every dot, every gray dot on this map represents 50 people on private domestic wells. So on any given day, 4 trillion pounds of these either oil or oil-like substances or these Clean Water Act hazardous substances are stored. 4 trillion pounds. And just within Louisiana alone, there's 500,000 private domestic wells within a half a mile. And we can see some big intersections here between a lot of wells around the Lake Charles area and a lot of these large above ground storage tanks. And of these 50,000 private domestic wells, it serves about 120,000 people daily. So this is just more of a localized snapshot looking just at Louisiana. But I should say that Texas is a state with a lot of these above ground storage tanks, especially in Houston. And Houston has a large percentage of its population in the suburbs on private domestic wells as well. The EPA has kind of taken a more forceful or emphasizing environmental justice recently. And typically when you think of environmental justice issues, the hotspots tend to be in urban areas, right? EPA kind of defines EJ communities as being low income, high minority, and exposed to some kind of environmental pollution, such as diesel particulate or proximity to NIPD permits, waste discharge, things like that. These are typically urban issues. I just want to point out that, well, there are a lot of unregulated, often untested private domestic wells in EJ communities. Here, every dot on the map represents a community that's the EPA defines as an EJ community, meeting the 80th percentile of your areas defined as a national EJ index greater than the 80th percentile. And then this is the population surge. The point here I'm just making is that there are underserved communities that are on water supplies that are not tested and could potentially be contaminated by some of the things we just talked about. And there's here just 21 million wells in each area serving 5.7 million people.
And then concurrent with this then is the conversation about where are these domestic wells in relationship to the septic systems. And actually the White House Environmental Justice Advisory Committee has recommended that there be more in-depth effort in looking at the septic systems, particularly in areas impacted by a lack of infrastructure and the ability then for these EJ communities to provide proper sanitation and water supplies in these communities. And one of the biggest things is here, of course, is that we have low-income households that spend about 10% of their income just to get water and proper sewer service to their homes. And so obviously, if they're spending 10% of their income on that, then the question is, can they even afford to monitor the private domestic well? Can they afford to upgrade the septic system? So they're unfortunately in positions where this co-location of the private domestic well and septic system, further drives the problem. So certainly the recommendation coming up here is development of a mapping tools in GIS where these homes are located. And indeed, Alex and I and another colleague are working on a way to update the location of the septic systems nationally. And of course, we'll be able to drill down to a local level to figure out where are these septic systems. And we're certainly finding in our endeavors here that it's highly variable across the states in terms of how that data is cataloged and how it is considered. So that's one of the things that we have underway, and certainly response to this effort, and ultimately a response to really protecting the private domestic well and water supply.
And I'm going to run through these very quickly because I definitely want to just give some time for questions. But I just the point of this slide is really just looking at this interface between disadvantaged communities on the right, who are reliant on private domestic wells, and here, the high co-location of septic systems and private domestic wells. Especially, you can see this kind of co-location of disadvantaged communities and these wells and septics, but definitely on the eastern seaboard and in areas of California. Same thing with the C&D landfills and the landfills. There are EJ communities are most impacted by these waste policies. Typically, they're sited, permitted in low-income communities that are relying on private domestic wells. We also just want to quickly just touch on issues of climate change and extreme weather events. In 2017, there was Hurricane Harvey. This blue area represents areas of inundation during Harvey. And then, these purple areas in Houston with a very high density of private domestic wells. A lot of wells were inundated. There were a lot of reports, news stories of EPA's Superfund areas that were flooded, inundated, and this wastewater left the site. This portends issues with our groundwater and concomitantly our water coming from our private domestic wells. About a 250,000 private domestic wells were inundated by Harvey rainfall. And then just really quickly, back to underground storage tanks. A lot of our underground storage tanks are really just kind of sitting in floodplains. We don't want water in our underground storage tanks. Tanks can pop out of the ground if they're inundated. It can cause corrosion and lead to that map that we saw earlier about all the leaking underground storage tanks. So there's about 250 million gallons of fuel and substance within FEMA's 100-year floodplain stored on any given day. Fran?
And then with regard to extreme precipitation, our concern is what does this do to the groundwater levels? And on the right-hand side, you'll see here, Wisconsin does a great job in looking at their groundwater levels. And in this particular instance with Dane County, you can look at the trends in the groundwater levels. And this is important for several reasons. One, where we have these increases in the groundwater level, what you're doing is reducing the attenuation capacity of that septic system or the underground storage tank, and where that water can be transported, in particular to a private domestic well. And then likewise, a related issue then is when you lose this distance, this vertical distance between the top of the groundwater and the bottom of the infrastructure, you have other routes of exposure for contaminants in addition to the private domestic well. So monitoring these water levels is absolutely critical in how we look at the function of the private domestic well and its potential impact from contaminant sources. And then we also just briefly wanted to touch on, relative to climate change, is the concern about sea level rise. NOAA has a great website and a link on the bottom of this slide that shows what the anticipated sea level rise is at various areas around the country. You can tune into very localized environments. Safe to say, how we think about private domestic wells and the increase of sea level, and also the movement of brackish water into these supply wells, is going to be ever more important. So if you have communities near the coast that are going to be subject to this, it's important for two reasons, not only for the given household, but then two, thinking about long range planning and water supply, and where will this water come from if indeed it's inundated at these levels. And And then lastly, this just speaks to the public water supply infrastructure. And obviously with the infrastructure bill coming out, there are needs on multiple fronts. One that we've seen historically, that the money that we've had for infrastructure has really been devoted to operation and maintenance, trying to keep our public water supplies up and running. And in contrast, little has been invested in actual infrastructure and expanding that infrastructure. And that's exactly concurrent with our data on the private domestic wells. We don't see, as Alex showed you in many of these urban areas, we don't see the expansion of the public water supply systems in these in certain regions. And so what we need to think about towards moving towards the future is not only where can this expansion happen, where are critical needs, and particularly in context with some of these contaminant sources. If we have ongoing multiple cumulative sources of contamination in given areas, that certainly can lend itself to an idea of prioritizing some of these areas towards public water supplies. And in particular, one of a key concern is obviously also lead in private drinking wells. There's been a recent study that showed indeed that children have elevated blood lead levels in private domestic wells as opposed to public water supply systems. And there's a variety of reasons for that. But to note here again, where we have old infrastructure, where we have children, there are different contexts that we can make in terms of decisions on our sites and investment of the infrastructure moving forward. So with that, I think we're happy to take questions if you're ready, Reem.
Great. Thank you so much for your insightful presentation, Fran and Alex. Just as a reminder to our audience, please drop your questions in the chat or the Q&A box. You could also raise your hand and ask to be unmuted so you can ask your question out loud, whatever is most convenient for you. I do see some questions up here in the Q&A box, so I'll just read those out, Alex and Fran. I believe the first one asked by Bridget, could you share the link to the map? I believe Dr. Kramer has shared the links already in the chat box, so that's where you can find them. We have a question from Jason Marion. He asks, syncing the type of data here with other national data, for example, the Environmental Public Health Tracking Network, CDC Wonder, NCI, SEER, etc., would be helpful. Would it be possible to create a CSV file with county FIPS code for many of these variables using a percent approach and then share that information publicly? Often public GIS data spans county boundaries and then users have to create the county level data. Could US EPA ORD help in this regard?
Yes, definitely. So the data is organized currently with, like I said, blocks and block groups. County boundaries perfectly match with those, so you can always aggregate that data up. So that's very doable and easy. I'm gonna just type my email address in the chat and email me, and we can work something out, and we can definitely provide this data by county if that's what you prefer. Did I answer all of that?
I think you did.
Yeah.
I see a similar question from Judy. Are these data available for download? It sounds like it is.
Yes. If you go to the web the web map that I just posted in the chat, at the top right there's a little I button, and that will tell you how you can download the data, spatial data in the geodatabase or by spreadsheet. Or if you have other issues, just email me.
Great, thank you. Another question, are there any studies showing the correlation of nitrates and organics?
Yeah, and this is some work that Shader and colleagues had done on Cape Cod, and and I can put the link in the chat. they looked at as a range of organics and were able to correlate the organic concentrations to nitrate concentrations. So I think we clearly have a beginning here of how to think about using simpler measures to identify other contaminants of concern.
Great, thank you. We'll give folks another minute to add any additional questions. And as we give folks some time, I guess I'll go ahead and ask a question. It was a very intriguing presentation, and towards the tail end, it got me thinking, Fran and Alex, how do you suppose these applications, the one focusing on private domestic wells and the USTs, how do you think that might be used by state and local health departments, as well as maybe even some advocacy groups? Have you been approached by organizations like that? And how do you think these applications will be used?
Alex and I just last year finished a whole round of training with all of our regions and all 50 states. And a big part of the audience was folks engaged in underground storage tanks. But we had also wanted to reach as well the water side of the house, and working particularly in state and local communities. We weren't quite as successful as we wanted on the water side, so we would very much look forward to working with folks here and colleagues to really crosswalk this issue and looking at contaminant sources and working with the private domestic well community at a national, a state, and a local level. And then another reason that we see this too is one that we're encountering recently, even for public water supply wells that are for, in a given instance, they're considered transient non-community wells. And so these are wells that you would find at gas stations. So similarly, this comes down to the local health departments in many states who have the oversight of these wells. So I think the conversation both about private domestic wells and these smaller drinking water systems is important to have at the national, the state, and the local level. So we're very, very interested in trying to really improve upon this vertical integration of communication, and as well collaboration in developing those interfaces.
Great, thank you. We'll take one last question that just came in. How much private well water, this comes from Jason, how much do you think private well water communities spend on bottled water or grocery purchased water? Is there any possibility of getting grocery level data from outbreak surveillance monitoring systems used by CDC? Knowing the financial impact and trust of water may be of value. Any insights on that?
Could you repeat that question again, just to make sure
Sure.
I understand the context?
Sure. So Jason's asking, I guess he's just wondering if you guys have access to this type of data, is how much do you think private well water communities spend on bottled water or grocery bought water? And is there any possibility of getting data like that, like grocery level data from outbreak surveillance monitoring systems used by CDC, and also knowing the financial impact and trust of water may be of value? So based on that, do you have access to that kind of data? Have you thought about using data like that?
I mean, that's an interesting twist on this. I think that's a good question. You know, if there's some kind of large scale contamination of private domestic wells, what's the financial burden of those people having to buy water? You know, there is data that can be purchased on basically you can buy from credit card companies, Dun and Bradstreet, perhaps. It's expensive data, but it's out there, and it is piquing my interest. But going on a limb, I would say that can be answered with the right data sets.
All right. Well, thank you so much.
And then
I'm sorry,
related
go
to
ahead.
that, one of the final things, thinking about the bottled water situation, one of the things that we're interested too is working with FEMA to understand what the water supply demands are in emergency response scenarios and providing bottled water in a sufficient capacity for accounting for those on private domestic wells. So that's very much, a part of what we want to do moving forward.
Great, thank you so much. All right, with that, folks, we're out of time for our session today, so let's wrap it up. I want to thank the speakers, Fran and Alex. Thanks so much for taking out the time and sharing your expertise. I also want to thank the attendees for participating. As a reminder, please do take the survey that'll pop up right after you exit this webinar. Also, regarding the annual survey, I'm dropping the link to the survey in the chat here. This is our Private Water Network annual survey that we're conducting as part of the anniversary celebration. So just note that that annual survey is for Private Water Network members, but it's also open to non-members as well. So if you'd like to take that survey, please, you're most welcome to. Also want to remind folks that tomorrow we will be releasing a blog post on the Private Water Network that's going to be titled Evaluation to Evolution, Revising the Private Water Network Online Community Platform based on member-driven feedback. On Thursday, we're kicking off the 2022 Private Water Network webinar series with a webinar on point-of-use water filters work, whether or not point-of-use water filters work for private wells. And Dr. Riley Mulhern from RTI will be providing an overview of a North Carolina pilot study that's focused on evaluating the safety and effectiveness of undersink water filters. And the registration link I am dropping in the chat here. So if you are interested, feel free to register and join us on Thursday. With that, thanks again for joining us today, and we will see you next time. Thanks all. Goodbye.
Thank you.